Hi, my name is Peter, and I'd like to talk a little bit about the COVID-19 pandemic. As of today, that is 19th of April, Africa has confirmed cases of about 13,000 against a population of 1.3 billion people. And coming closer home, Kenya has confirmed 262 cases against a population of 50 million. And so far, we've been able to test around 11,000 people. Now, when you look at these figures, it shows that our test population against the total population is very small, is actually less than 1%. And we don't know right now the extent of the spread of COVID-19. And as you've seen from the news, there's a big shortage in terms of supplies, medical supplies, and test equipment, the test kits for COVID-19. So we have come up with a project that may help the government and healthcare workers across Kenya and across Africa in terms of testing and optimizing their supplies towards testing for COVID-19. You see, fever is the first the first indicator of COVID-19, and if we can be able to test the people who have fever and narrow down to the ones whose temperatures are higher than normal, then we can be able to optimize the test kits such that these people who are indicating signs of having a fever, the ones who are prioritized in terms of testing now for COVID-19. So when you look at the Kenyan setup and Africa setup, mostly around 80% of the people are rural and agrarian. Now, if most of them are rural based, then it means like 80% of people have not been tested, and it may take a lot of resources in terms of getting to them and being able to test all of them. Now, the key thing is how do we now optimize what is available in order to maximize the number of tests and limit the spread of the virus with the limited resources that we have. So we've come up with a non-contact fever detector that also has integrated telemetry, such that when people are tested, then that information can be sent to a central server, and analysis can be done on that data so that our dashboard can plot out the cases that are high. And this will also help in terms of contact tracing, because we also capture a unique identifier of the citizen who's been tested. So for example, we capture either a phone number or an ID number, depending on what the person can give. Now, with this information and sending that information to an online server, it enables analysis to be done on that data, not just narrowing down the people and tracing their contacts, but when you look at temperature trends across the region and being able to map out or apply AI and machine learning algorithms onto that data, then it becomes possible to actually predict the direction in which the spread of the virus is going, and be able to mobilize resources in that direction, or send medics to those areas that are showing potential of high risk. One key thing of note is that the fever detectors that have been deployed across Kenya and across Africa do not actually have telemetry, and most of them are designed for in-house use. So you find that none of them is actually sending that data anywhere, or capturing it in a form that can be analyzed. And that information is being recorded on paper records or in books, and this does not allow for quick and accurate kind of analysis. So our system is designed to enable that, so that we can be able to apply existing tools, machine learning, artificial intelligence, data science, onto the data that is being collected, and with location information be able to actually map out the spread of the virus across Kenya and across Africa. And with that, we can be able to now optimize the resources, because there's been a lot of focus on the need for ventilators, which is good, and which is good to have and be prepared for. But we find that by the time someone gets to the point that they need a ventilator, then it means the cases are too late. And if you look at Kenya, we only have 518 ICU beds against a population of 50 million. So if the cases increase, then it becomes a bigger problem for Kenya and even for Africa at large. So we are asking for support from governments, from healthcare providers, healthcare officers, epidemiologists, and financial supporters who can be able to work with us and help us, so that we can be able to ramp up the development and delivery of this device and platform for general use in the public, so that we can be able to contribute towards the fight against COVID-19. Thank you. Here we have our non-contact fever detector with remote telemetry next to a standard non-contact fever detector. The sizes are not very different, as you can see. So we have an on-off switch on ours. We have a keypad, a display, a trigger button, a laser pointer, and the infrared thermometer. Then we also have a GSM and a GPS antenna. We are using an active GPS antenna because the passive one, even though it can work, it takes a bit long to connect to network. So the operation is simple. You just press the trigger button. It will record the temperatures, maximum and an average, and then ask for a unique identifier. We can use a phone number or an ID number as the unique identifier. So in this case, we just enter a random number. And then we press the hash to send the information. So the data, once the temperature readings have been taken and the data sent, the system just goes back to standby and waits for the next request or the next trigger from the trigger button. So with the information gone to the server, we set two values. We set a minimum and a maximum, such that if those thresholds are passed, then the colors of on the dashboard change depending on what information is received. So for example, if the temperatures are higher than the preset threshold, then the system will flag it as red. But if it's below the set threshold, then it will be green, meaning that the person whose temperatures has been flagged as red indicates a higher risk of having a fever. So they need to now be taken for now the coronavirus test, so that the information can now be analyzed, and we are able to now figure out if that person has COVID-19 or not. So here we have our online dashboard. As you can see, it has 5 sections. We have the temperature reading, the test locations, the date and time of last report, total packets that have been recorded, and the battery level of the reporting device. So from the temperatures, you can see that values that are above a set threshold are highlighted red, but those that are below the threshold are green. So we normally capture the average and the maximum. We do an average of 10 readings and the maximum of those 10 readings. And then we also get the location, exact location of where the tests were done. So in this case, you can see from the map, it's showing that there's a cluster here, meaning I was just around the office when I was conducting the tests. Then we have the time of last report. So you can also be able to tell if the devices have not been reporting, you can be able to note immediately. Then we have the number of test points that have been taken, the data points that have been taken. So this also gives the count of the number of people whose measurements have been recorded. Then we have the battery also of the reporting device, so that whoever is using it can also be alerted when they need to recharge the device. So you can see from here that for every reading, there's an attached citizen ID. So we said this is either a phone number or an ID number. And this is something that can be used to uniquely identify a person. So for example, when only the maximum is high, you can see that's what is highlighted. But when both are high, the maximum and the average, then both of them are highlighted. So what happens in this case is that if this person was tested and they were found to have a fever, then now they are taken for the COVID-19 test, so as to ascertain whether it's just a normal fever or if it is related to COVID-19. And because we're also capturing the citizen ID and the locations, then health officers can actually use this information, for example, to identify who are around this person at the time when their reading was taken. So these people can be alerted also that they may need to be investigated for COVID-19. So what will happen is, in such a case then, tracing the people who are around someone who may be showing symptoms for COVID-19 becomes easier and faster. And because also the location information is saved, then the health officers can actually narrow their search for these people, and they can be able to trace them faster. So note that we are not saying that this platform is for testing COVID-19. It is for testing signs of fever, which is the first sign of COVID-19, such that if there is a fever that is noted, then that is the case that we prioritize now, so that they can be tested for COVID-19. If it is a normal fever, then the person can be released, but if it is COVID-19, then they can be now quarantined. And it also enables actual tracing of the people who are around the same place with the person who's tested positive. Because the device also gives timestamps, so you can know that within this particular location, these people were around that place. And from transmission from the actual hardware to the server, it takes about 1 to 2 minutes. So it's fast enough and will enable testing of a lot of people from one device of a given period of time. This is because, like in Kenya, so far we've tested less than 1% of the population, and the tests need to be ramped up so that we can be able to handle the situations that are not critical early enough. Because, as everyone knows, we have a big shortage of ventilators, and if it gets to a point where someone needs a ventilator, that it means it's already a bit too late. Thank you.